Welcome, everyone, to another episode of the Health Made Simple Show. I'm your host, Dr. Bart. Today, I have an exciting show for you. Today, we're going to do a little deep dive on the clinical insights. It's probably the most popular show that we do. This is the one I get the most requests for. And if you're not familiar with what the clinical insights are, really what they are, or if you're new, welcome, of course. We love having you here. And if you've been listening for a while, love having you here as well. If you're unfamiliar with the clinical insights, that is when I'm in clinic. I have some insights that I think would be important or valuable to share with everybody. Meaning that there's a very good chance that many of the things that I experience in clinic, I'm still practicing, that when I have an experience with someone, a conversation, an outcome, a result, a breakthrough, something that I think if many of us heard this, we would all be able to relate or benefit in some way, shape, or form. So that's what we're going to do today. I've got two, and one of them, stay tuned, is about me and my journey with cholesterol, especially right after the carnivore journey that I just went on. I'm kind of still on as well. So stay tuned for that. Don't miss out on that one. So I'm going to cover two things for you today. And first, let me, of course, just welcome back everyone. Thanks for being here. Keep doing your thing. Keep sharing it out. Keep spreading love. This is how we grow. This is how we get this information in other people's hands to help them continue their journey on health. Do your best that you can. If you're listening on Spotify or an Apple, wherever you listen to your podcast, please go there. Give us a 5-star review. It does help. And then if you get an opportunity to say something, share something, even ask a question, we'd love that as well. All right, let's dive in. Again, welcome everyone to the Health Made Simple Show. So our first clinical insight, I'm going to talk to you about a therapy, which I think is one of the most absolute best therapies that are out there right now we'll call it in the natural field out there. So there's something that's called sound wave therapy. It's also called shock wave therapy, and it's also called soft wave therapy. We happen to have one of these units in our office, and they're becoming more and more, I'd say, popular in clinics all across the country. Just about every major professional sport team has one now, multiples for that matter. It's absolutely phenomenal. And I want to do a little deep dive and share with you the reason why and who it might be applicable for. Again, it's called sound wave therapy, shock wave therapy. And I don't really like to use that name because it sounds a little aggressive. Or soft wave therapy. So sound, soft, or shock wave therapy, really all the same thing. Some of the companies will tell you that they're the best ones and they only the ones getting results. It's not true. They're all, for the most part, using some of the same technology. So any one of the companies that you get or have access to would be phenomenal. So who's it good for? Let's start there, and then I'll tell you a little bit about what it's doing. Anyone, listen, if you have a pain situation, let's say you have arthritis. Let's just say that you have degenerative joint disease. You've got a disc issue. Let's just say you've got tennis elbow or golfer's elbow, which frankly, it's, the golfer's is on the inside of the elbow, tennis is on the outside of the elbow. Let's say you have anything to do with a tendonitis, if you have ligament issues, if you have old scar tissue from an injury or maybe a surgery you had in your knee from 20 years ago, for maybe a foot surgery you had 15 years ago, a shoulder surgery you had when you were back in college or whatever it may be. This is the therapy for it. It absolutely gets amazing results. When I say amazing results, this might not sound like a lot to you, but I'm telling you, it's borderline groundbreaking. The results, the positive effects that we get from sound wave therapy, that's what we call it in our office, the sound wave therapy, the results are 60 to 90% beneficial. There's zero, not even aspirin, has a 60 to 90% success rate. So trust me when I say this is phenomenal. And it's one of the safest therapies out there that you can possibly do. So let me explain a couple of things that how it goes about, and then I'll tell you if you have anything chronic injuries, and I'll share some of my experiences as well personally and how it came about in my office. If you have any chronic injuries, this is the thing for you to do. So this is how it works. It's a sound wave therapy. It penetrates through the skin into the tissue, the muscles, tendons, and ligaments, and it gets to the area where the abnormal tissue, that might be scar tissue, that might be injured tissue, might be inflamed tissue, whatever it may be, and it literally starts to break it down. It starts to help remodel that tissue. That elicits a stem cell response. That inflammatory response is replacing, so this is the cool part about it. It's not just downregulating and modulating pain, it's replacing the old tissue with new tissue. So if you have injuries, we're talking about repairing things that have been defunct for maybe decades, and you're literally getting function back. The amount of people we're seeing right now that have chronic knee injuries. I've had knee injuries for this long. I've had shoulder issues for years, foot injuries for decades, and seeing this stuff clear up, it absolutely excites me. So I want to share that with you here today in a clinical insight. Quick story here on why I have it and things I've seen with my own body. So not too long ago, I think I shared with you, many of you, it's been a little while now. About 2 years ago, I tore my meniscus in my right knee. And as many of you know, that if you're in healthcare, if you're a healthcare provider, we've always been taught that you cannot heal meniscus because it's avascular or has very, very little vascular components. So it's hard to regenerate the tissue. My options were surgery or just live with it. So I was living with it for about 18 months and I was doing everything I possibly could. When I say everything, I was doing a lot. But that phrase, everything I possibly could, is a limitation because there was obviously more that I wasn't doing. In my mind, and this is for everyone out there, if you have an injury, you have this old chronic thing, and you have said, I'm doing everything. If you haven't done soft wave therapy yet, you haven't done everything. And that was where I was at. So eventually, I had this young girl come into my office. She had a mobile unit. She came into my office. She started treating my knee on a regular basis. And I started seeing results in a couple weeks. Probably in about a couple weeks. Now, mind you, I was on my feet every day. I didn't get an opportunity to give it a break at all. So I chose that I did not want to have surgery. And I got the MRIs, got some, I got multiple people to give me some insights on what they thought would be best. They said, Bart, this is very simple surgery. You can go in and out. You'd be out of the operating room that day, back into your practice within a day or two, et cetera. I just did not want to have that operation, knowing, quite frankly, that if I was to operate on my knee, then at that point going forward, there would be more of a dehydrated situation with the tissues in there, and my knee would be inevitably, even though I'd be out of pain, it inevitably would be compromised from that point forward. And I just wasn't ready for that in my life at that time. So I kind of held out, eventually did some sound wave therapy. Making a long story short, did multiple rounds. So I did probably 12 sessions. And at this point, I'm full blown back into whatever I want to do. So I'm back into kickboxing, back into jiu-jitsu. I actually injured at kickboxing. Yet nonetheless, I can full out kick with that knee, I can practice jiu-jitsu. Anyone who does those sports knows it's pretty rough on the knees, but nonetheless. So then I kept going. I've had shoulder surgeries. I've had shoulder issues. I've had numbness and tingling in my arms, all of that stuff. All of that stuff is gone. Do I do a lot of other things? Absolutely. But this, to me, especially with the chronic issues, if you have chronic pains, knees, ankles, joints, shoulders, whatever it may be, you have an old rib injury, a cervical spine issue, any old injury, especially if it's arthritic and has scar tissue, sound wave therapy, soft wave therapy, shock wave therapy may be that thing that changes the game for you. So I highly encourage it and highly recommend it. Is it safe? Absolutely. It's considered, the unit we have is considered a class 1, which is, I think, in the same category as a Band-Aid. So it's probably one of the safer things to do. A lot of people know about it? No, and I'm shocked by it. Yet I think just in a short period of time, a lot of people are going to hear about it and a lot of people are going to start to do it. So we have one in our clinic, which is available 5-6 days a week. So we're glad to help you out. And if not, you're going to look around Google for places that have either sound wave, shock wave, or soft wave therapy. They are essentially all the same thing, and get with your peeps and get with that provider and figure out what the best program is for you. Typically in our office, I start people, say, give yourself at least opportunity for 6 sessions. You spread them out a little bit, maybe about 2 a week. Do that for about 3 weeks, maybe a month. Sometimes you need a little bit more, depending on the severity of the injury, how much you're still using it. We forget about those things. I was still on my feet every single day. I was still exercising. I wasn't running or anything like that. I literally could not run. The amount of pain in my knee was crazy. Anyways, I probably could have shortened that if I was able to stay off my knee. I don't know how how you can do that, but nonetheless, that frame that I used, 10, 12 weeks, was well worth the healing, because now I don't have any knee issues, which is great. When people say, well, how's your knee? It's perfectly fine. Most of the time, I don't even remember which knee it was. So with that being said, if you have any chronic injuries, go out, find, especially if you or someone you know has said, I've done everything. Unless they've done sound wave therapy, soft wave therapy, or shock wave therapy. If they haven't done that yet, make sure you get them this podcast, have them listen to that. There's still opportunity for them to do the healing. And that's the beauty, folks. We're not just talking about pain modulation. Does it help with pain? It absolutely does. The beauty is that it's helping break up that scar tissue where the nerves are bound in. The nerves are getting, when you have scar tissue, folks, the nerves are often getting stuck in there. And the longer they're there, those nerves get compressed. That starts radiating down your leg, down your arms, into your shoulders, etc. So when we break all that up, we start to change the anatomy in there. You start to get to remodel it, and you literally heal in that area. So you can kind of hear it in my voice. Super excited to be able to offer it, and super excited to bring it to you, and encourage you that if you have old injuries, you or your friends know that there's other opportunities out there that don't require necessarily surgery and or drugs. And I know there's a time and place for those, but the more that we see these types of therapies, these types of options, and these different types of things that we can do with our own lifestyles, less and less need for the drugs, and especially less and less need for the surgeries. All right. With that being said, let's move on to our next one. This is kind of exciting as well. This clinical insight is about me, but it's really not about me. This is about cholesterol. And I know that this is a topic that over the years has always been kind of shut down. Like, you have high cholesterol, it's bad, and therefore you need to lower it automatically. And I think in this last probably 5 years, especially this last like 2 years, we have seen a lot of other conversation around cholesterol. I've been talking about it for over a decade, probably 2 decades now, and so has many other healthcare practitioners saying, you know what, cholesterol is not the bad guy. So anyways, the challenge that a lot of us natural healthcare providers, functional medicine docs, et cetera, see out there is that we'll see good, healthy people have such fear or manipulation of the mindset around cholesterol. They'll go to their doctor, their doctor will say, look, your cholesterol is getting a little bit high here. Let's do the preventative thing and go ahead and put you on a statin early. You're only at 205, 210, 215, maybe 230. Let's get you on that and get it lowered before anything bad happens. And then that individual, maybe that's even you've been hearing about how bad cholesterol is your entire life, and you're thinking, man, I got to get this down. That sounds like some good advice. And you go on a cholesterol medication, and you don't really even know why, other than high cholesterol is in theory bad, and you don't even know what kinds, and you haven't even done the appropriate testing. And I'm not trying to spank you, but I am trying to kind of poke you to open up your mind and say, hey, listen, there's a lot of other things that we can look at. So I'm going to share with you some personal numbers, and I'm sharing with you this not to say that I do things good, bad, or indifferent, but an experience of what I have with our patients all the time. So, and listen, you're not alone out there. I would say that currently right now, I'm probably under my care, I have over 100 different doctors. And one of the primary things that I'm working with a lot of these doctors is managing their lipid levels, their cholesterols, which means that we do a deep dive. And when I say deep dive, what does that mean? There's a total number that you get, what they call total cholesterol, too often, way too often. That's the only number we look at. We go, oh, total cholesterol is running a little high. In theory, the number is 200. That's the number that if you're at 200 or below, it doesn't show up as in red on your lab report. If it's at 201, you'll get a red mark and it'll say high. And folks, that is not, we can't just look at that number, which I'm going to show you, I'm going to talk to you about in just a moment, with my numbers. We can't look at that and make the overall judgment if you have a cholesterol issue or lipid metabolism. That's what we're looking at. Do we have a lipid metabolism challenge here? So those deep dives, and just a quick reminder for any of you out there, yes, we can help you run these labs. We can send you a requisite anywhere in the country, doesn't matter. We do this all the time. We can send it to you. You and I can sit down. We can look at your cholesterol and all your other labs, whatever labs you might want to get, whatever ones we may recommend, sit down and create a strategy, create a plan for your lifestyle, for your nutrition, whatever it might be, for vitamins or minerals or herbs, whatever it may be, to help you get back into the best, version of yourself. So any way you want, you just call our office. We'll make sure there's a link below to either call or email us. Anyways, when it comes to lipid panel, we want to look at other markers to determine our overall cardiovascular risk. If we're running our labs, we're trying to see where can we make changes to enhance our cardiovascular system and also to prevent and or avoid cardiovascular damage. So just off the top here, so total cholesterol is one of the numbers, but also one of the least important ones we're looking at. Some of the ones we do want to look at is the relationship between triglycerides and what we call the good guys, the HDLs. So there's a ratio there. We like to see those about 1-to-1, or at least generally heading in that direction. Guys, like to see those HDLs at least 40, preferably 50 or above. Women, we'd like to see those around 50 or above. The triglycerides, traditionally they'll say you want to be under 150. I lean toward under 100. The triglycerides instantly tell me what kind of diet you do or do not have. If you're eating fried foods, if you're having alcohol, processed foods, all that kind of stuff will show up in your triglycerides. We look at the LDLs, which is notoriously called the bad guys. And this is where it really is so important that your labs and who you are, your lifestyle, are put together. And that's critical that your doctor knows who you are. If you are a couch potato and you have high LDLs, there's a risk factor, no doubt. If you are an athlete, a CrossFit athlete, you run every day, you get on Peloton, you are breaking down tissue, you're working out, and you're rebuilding cells on a daily basis, I expect there to be high LDLs. LDLs are healing agents. They're hanging out in your liver, and when there's damage somewhere in the body, some tissue that's been broke down, and that's exactly what we do when we exercise, we break down tissue. I expect to see elevated LDLs. So all of this together, knowing who you are, your sleep patterns, your food, all of this determines the type of strategies we can have moving forward. But just looking at your labs and putting you on a drug, a medication, or for that matter, an herb or whatever it may be, is not enough. And I can't emphasize this part of it enough, because I know if I hand my labs to another practitioner, they wouldn't be able to comprehend or get past the total number, which I'm going to share with you in just a moment here. So with that being said, and there's a lot of other. So we do even a deeper dive. Some of you know, or you've run your labs with me before. We run APOB, which is a kind of a classic one to find out cardiovascular health. So all of these, now we'll jump into me and kind of share with what my labs look like. So a couple months back, we kicked off our carnivore challenge. I forget the actual dates of it. Anyways, I did the carnivore hardcore for about 30 days. I say hardcore, I do a modified carnivore. I do all the animal products. So that would be meat, but also include dairy and cheese, and then fruit as desired. So that's pretty much my recommendations often when we're running carnivore. And after the labs, now traditionally, I'm going to back you up a little bit. Historically, my total cholesterol usually runs between 225 and about 240. Most traditional doctors would say, that's too high. You need to do something. You need to change something. So if I whisper to them that I'm on a carnivore diet, immediately they're going to say, that's what you need to change. You got to get off it. My answer to that would be, then what should I go on? What should I go on? More carbohydrates? Should I eat more pasta, more muffins, more crackers? Should I have more pizza instead of burgers? And then, so there's usually, other than just get off carnivore, there's usually not much advice. The obvious answer there would be, if you want to get off carnivore, maybe you'd lean into more vegetables or more fruits, etc. Yet, let me kind of continue on here because it's important. So I test back in May. And when I tested in May, my total cholesterol was 275, the highest I have seen it in my life. That was my total cholesterol. So if you're looking at that number by itself, you would say, wow, doc, that's super high. Wait a minute. There's got to be something wrong with it. You can't tell me that this is okay. And I would say, again, to what I said earlier, the total number is not the most important number. Understanding the ratios and understanding what else goes with that is what's really important. And I'm going to share with you also what I did about that total number, which is probably, it should kind of really shock you. And I'll share that in just a moment. But in that moment when they were 275, I ran my small particles, my small LDLs, and they were very low. We ran my insulin resistance numbers. Didn't even exist. We didn't even skip. I didn't even kind of come into what they call the low categories below that. Ran insulin below low. So all of the other markers, APOB, perfectly fine. HDLs, perfectly fine. Well, yeah, perfectly fine. I like to see them a little higher. They're right around 50 at the time. Triglycerides were about 79. And this is important to understand this. So triglycerides were about 79 and my HDLs were in the 50s. So it's not quite a 1-to-1 ratio. There's room for improvement, but that's actually pretty good for a male. And then my LDLs were run a little bit high. They were probably in the 145, if I remember correctly here. All right, so move forward. Fast forward. So we saw that at the end of May. 6 weeks later, I decided to retest some of these markers here. Really, I wanted to see what I could do with that total number in 6 weeks. Important to tell you here that I did not change my diet. I did not all of a sudden add a bunch of vegetables. I didn't do that. For those especially know, you can ask my wife, pretty much I eat burgers and steak almost every day. I have copious amounts of cheese. I do use dairy. Everything's clean. Everything's 100% organic. We know everything where everything comes from. I eat copious amounts of eggs, which have high cholesterol in theory, right? So all the good guys, etc. So I did not change my diet. And I'll repeat that. I did not change my diet. My total cholesterol is at 275. But what I did do was I supported my system in helping my body become better at lipid management. And this is interesting. So if you guys caught my last podcast, I think the last episode or two before that, I did an episode on berberine, which I wish I had these results for that because I would have been a little bit more jazzed, even more jazzed about berberine than I was then. So I went on a dosing of, those of you who are not familiar with the herb berberine. So berberine, a lot of people have talked about it as being the natural Ozempic. I don't believe that it is, but I do understand that it has very medicinal values for helping our bodies become better lipid burners, better at burning fat, at lipid management, and also blood glucose levels, which basically means you're helping your liver and your pancreas. And those are two very important things. And sometimes, yes, as we age, we need some extra support. That is true. Sometimes we beat our bodies up. I've definitely beat my body up over the years after, playing rugby for, a decade or so, whatever that was, and doing all the things that come along with playing rugby and drinking beer and all that good stuff. I did all that to my body. So do I think that my body's in a perfect state after 50 years of beating it down? No. So helping our bodies along the way could be the key here. So this is what I did. I took 4 berberine a day, and I took something else. I took 8 AF beta foods. If you've heard me ever talk about gallbladder in the past, anyone that has a gallbladder issue, if you're chronic, like burping or farting, quite frankly, or gas or anything like that, bloating, I often will start someone on AF beta foods, a product that comes from Standard Process. And really what it is a beet product, and it helps thin the bile in the liver. So your body can help break down foods, especially fats, better. So my goal here was, knowing that my total cholesterol level was a little bit high, I decided that I would look to become a better fat burning machine from the inside, literally using my liver and my pancreas to support those opportunities. So sure enough, 6 weeks, folks, 6 weeks, I went from 275 down to 208. I haven't been at 208. I don't know that I've ever been at 208, which is absolutely fascinating. And again, I'm going to tell you a couple of things. I did not change my diet, and I dropped over 70 points, or roughly 70 points in 6 weeks. Now, with that being said, my triglycerides dropped from roughly 80 to about 60. So almost 20 points, your triglycerides. So those 80 is a perfectly good number, 79, 80. But dropping them down to 60 is fantastic. And my HDLs came up. Why am I sharing all this with you? Listen, sometimes people say, well, I eat good. I don't want to take all those things. And I get that. I think I fall into that category. I would rather see you, before you take any supplements, I would love to see you change your diet. My eye opener, I use this protocol for everyone that has lipid levels that are high. If they have challenges with small particles, LDLs, all of the above, we use berberine. Often I'll use AF beta food, but always berberine because of how effective it is. So we dropped almost 70 points in 6 weeks. I feel amazing. I don't feel any difference when you drop your cholesterol. I don't feel any difference whatsoever. I just feel mentally great because I could see that number manipulated a little bit by just using some extra herbs, knowing that my body's managing these. All of my other lipids got better. They were already good, and they got even better. So the reason I'm sharing this with you today is that this is what we do with our clients all the time. We run your lipid panels, and then I put you on the herbs. Sometimes, some of you listening, listen close to this. Here's what I try to tell everyone. They don't work if you don't take them. That's 100% guaranteed. Sometimes, not every herb and every vitamin, every nutrient that you take, you're going to feel doing their job. I do not feel any different that my cholesterol is lowered. It doesn't I literally have no idea. These are just numbers on a piece of paper to me. Yet knowing that, I was able to manipulate them, it's probably not the right word, lower them, because my body now became more efficient because I added some of nature's medicine. Berberine is an herb. I used 4 a day for 6 weeks. That's not a long period of time. Will I stay on them? I'm probably going to stay on them. I'll take a lower dose. And this is exactly what we do. I load people up usually about 30 days for about 4, and then I start to decrease that dose down to 2 a day for another 60 days. And usually I have people take 1 berberine on a daily basis, just as good health maintenance to make sure that we continue to be good lipid metabolizers. So that's my clinical insight for you today. Cholesterol, again, this is a great topic that I think is getting more and more publicity in a right way this time. We're losing some of the fear of it and understanding it a little bit better. Part of your cholesterol is important to help you heal. Most of your brain has some level of cholesterol. Part of it you need, 50% of your brain is fat. 50% of that, something called DHA. We should also be checking your omega-3 levels to make sure that you have enough cholesterol built up in your brain. Some of the most fundamental things that we never talk about with cholesterol, like mother's milk, is made predominantly of cholesterol. That's how we make babies. So is cholesterol good for us? Yes, the good type. So measuring all of what's taking place and then taking the appropriate actions. And again, hear me, diet is always going to be first. If you've got a crap diet, that's got to go. Yeah. So the things that usually create the bad higher levels of things like triglycerides and the LDLs, the inflammatory stuff, is lifestyle, sedentary lifestyle, along with bad diet. And there's millions, tens of millions of people in that category. Just don't be one of them. So, all right, with that being said, hopefully that lands in a place that gives you a little inspiration, gives you a little bit of a aha. I could probably do things a little bit better, and it might not be that hard. Again, folks, 6 weeks to change my cholesterol levels, and I shared with you a little bit about me being able to get my knee back into an operable state where I can literally do anything and everything I want to. And that was 10 or 12 weeks. And that's not a big amount of time to be able to continue to, explore life at your fullest, just as a result of a couple of weeks of therapy. All right. With that being said, keep doing your thing, keep sharing it out, keep raising the bar when it comes to your mind, your body, overall wellness, and you all be awesome.